Hello, my name is Abdisa from Oromo Youth Community based in Perth. Today I'm here with Dr. Bahar Yusuf, who is a Melbourne-based GP and a chairperson of RISA Foundation, a youth-focused organization established in November 2019. The organization provides mentoring and leadership opportunities for young Africans. Today we're gonna speak in both language, Afan Oromo and English. Dr. Bahar earlier joined us via Zoom conference to explain the significance of the COVID-19 vaccine in our language, Afan Oromo. So I would like to welcome Dr. Bahar Yusuf to Perth. Just to start our conversation, Doctor, could you please tell me, as a health professional, as a doctor, how do you learn to tell someone that they have terminal illness or they are dying?
Thank you, Abdisa. Thank you for the very kind introduction. It's a very important question and very interesting question to start an interview, in fact. So, yeah, but it is something that's inevitable, though, as a health professional. When you're dealing with diseases and, with terminal illnesses, quite often we encounter patients who have, terminal illness or who are dying from various diseases. I think those situations are very sensitive. It is that kind of situation, we approach it in a very tactful, very sensitive manner. And how do you tell someone you're dying? I think it's with difficulty, but it's something that we actually practice with time. Yeah. It's difficult when you have to deal with these kind of things at the beginning, but eventually you kind of practice and you develop a system that you develop. You break the news to the patient or sometimes to the family members of the person who is dying, but also be empathetic and be understanding of trying to see the reaction that you. So I think there is a system that we follow. Generally, what we do is we try to get as much information as possible. We try to set the situation and set the scenario, what the patient might be feeling. Then we have to do this in a very private, in a very environment environment that's calm, that the patient or the family would be able to express their emotions as well, because it's a very significant information and a very difficult information. We know once person receive this kind of information, they're gonna react somehow, so we have to be prepared for that. And before breaking this kind of news, we usually try to engage with the person, try to ask how much they know about the situation. For example, if you're telling someone they have metastatic cancer that has spread and they have very short period of time to live, they often have had tests and investigations that confirms that, and they have some sort of understanding of where the conversation is going. But before we break that down to them, but we need to assess how much they know of the situation. And once we get that, then we directly tell them what's going on. And when we tell them, we don't sugarcoat it as well. So like, this is what's happened. So we've had this test. So we have assessed how much they know. And, the disease is terminal and you probably have this much time to live. And you're probably going to die. Because that saves time. It's going to be a big shock if they were not expecting. But that saves a lot of time. And once we tell that information, we kind of be empathetic. That's where empathy comes in, trying to step back and try to assess what are the emotions of the patient. Some patients are usually in shock. They become speechless and they don't even talk about anything. While other patients can be very reactive and what's like it? So no matter what situation, we need to expect some sort of emotion is going to be to come up, and being understanding of that. I know this is a very difficult news to absorb, and this is a lot to take in. And usually before this happens, it's a good idea to actually ask them if they need someone with them. I mean, this is like I said, very we call it bad news. It's one of the worst news we could hear. Like you're dying. So we need to ask them whether they need someone with them for support, whether it's a family member or a loved ones, and that would help during that emotional time. And so after that, I think you follow patient's reaction and patient's emotion, depending on how the patient is at that time. Once you break this kind of news to a patient, usually they may not be ready for further information, and they might just say, I need time to process this, and I need someone with me, or I need to go home. So in that instance, it has to be guided by the patient, and how we can approach this. Whereas some of them be in shock, and then and we need to be understanding as well. Once we're breaking this information, whatever we talk after, they may not be absorbing all the information that we're breaking to them. So when that happens, I think give them an alternative. If you want to go home and talk to someone, and it's a very stressful environment, we can organize. If they want to talk to someone, in the form of counseling, or whether they have enough support from the family members. So it goes down. So it is a very difficult topic. It's a very difficult situation to actually discuss with the patients or the families, but it is something that has to be done, and that is happening in time. And sometimes we have to be mindful as well, like as doctors, sometimes if you are working in a busy hospital, you may not have time to actually go through this, and because you've got a lot of things on your plate, and there will be a next patient, and so we have to be mindful of that. And when we are breaking this kind of news to a patient, we need to make sure we have set enough time to actually go through the patient's emotion. And some of the patients may take time to actually absorb and to deal with this kind of information. Yeah,
that's amazing. Thank you, doctor, for that. Before, as I've said earlier, Dr. Bahar joined us through Zoom to explain the significance of the COVID-19 vaccine from Melbourne through Zoom. So I want to quote what Mr. Mandela said. If you talk to a people in a language they understand, that goes to their head. If you talk to them in their own language, that goes to their heart. This is a typical message that I want to send out. When you have a doctor who speaks your language, speak to you in your language, on that conference, I learned that a number of our community were engaged in questions. A number of questions were raised. A number of questions were got answered for our community. For that, by using this chance, I would like to say thank you to Doctor. So we were talking about Dr. Bahar. Could you please briefly tell us about yourself for my viewers? Where did you study your doctor degree? How did you came over here? And what are you doing here?
Thank you again. I'm Melbourne. At the moment, I'm a general practitioner. I'm also I'm a medical practitioner in Melbourne, working as a GP for the past 6 years. Originally studied in Pakistan, and then moved here after doing my internship. And at the moment I'm doing that same GP job and a bit of working in emergency as well in different parts of kind of regional areas.
That's really great. Yeah, look, as a health professional, I studied clinical nursing back home. When I came over here, I applied to Overseas Qualification Center, but the result I got was not what I expected. Due to that reason, I went back to uni. Apparently, I'm doing medical science at Edikwan University. What would you, what is the challenge to get into the job when you study overseas and come over here?
Well, I think moving from one country to another country is a challenge in itself, because when you change countries, so you're going in a country that speaks different language, different culture, and on top of that, if you wanna pursue your career, so you have to navigate a different healthcare system. I think that adjusting to a new country, adjusting to a new system has been a challenge. Part of that adjustment as a medical practitioner required for me to actually undergo few exams to get my qualifications recognized. So as a medical practitioner in Australia, so you have to register with a APRA, with a medical board. And once you have that license, and then you get a job. But it's a bit different. I think it's a bit complicated. When you come to Australia, there are three kind of bodies that you need to be registered. So one is you have to register first with the Australian Medical Council. That's where you actually register your qualification. Once they kind of verify that the degree you have is actually valid or genuine, and once that is verified, they tell you to sit exams. So they have to sit. There's a that MCQ exam, and then there is a clinical exam. And once you have that, you'll get a certificate from the council. So that's one part of the examination, the education standard equivalency kind of system. But to practice, you need a license. As a doctor, the license you get is from the medical board of APRA, yeah? And that has its own challenges as well. So they have different criteria. So for that part, you need to pass an English exam. There are different kind of exams that you have to sit, and those exams are only valid for about 2 years. If you don't get a job during that 2-year period, then you'll have to do the exam again, the English exam again, because it's a thing. And once you get that, and then the complexity is to get a license from APRA, you need to have a job first. So that means you need to have a hospital or a clinic that actually trusts you. We give you a job, and then only APRA will give you a license. And then once that happened, and then there is a Medicare. So you have to apply to Medicare to get a provider number. So every doctor in Australia, they have their own provider number depending on the location. And that can be very complex for international medical graduates. Well.
Oh, thank you very much for that, Doctor. So, Doctor is here from Melbourne. He came here Perth. What brought you here, Doctor?
Work brought me here. I think, so like I said previously, I've been working as a general practitioner, and I have worked in rural regional Victoria over the last few months. Now I wanted to kind of increase my experience and get a bit more in depth. I'm actually going to remote areas of kind of Western Australia. So I'm in Perth for this week. I'll be flying out this weekend, going to Broome, and then from there going to a very local hospital.